Hi everyone and welcome to our Savvy Ladies Wednesday Wisdom webinar. My name is Maggie Montemuro and I'm the Marketing Coordinator at Savvy Ladies. If you have a question during the presentation, you can type it into the chat window. Or if you're joining us by phone, you can email your question to info@savvyladies.org. Today's presenter is Erin Fisher, President of FindMedicarePlans.com, which assists people with finding the Medicare plans that best fit their health and financial needs. Erin has over 20 years of experience in the Medicare industry. She is a member of the National Medicare Advisory Committee and an active member and board member of other organizations in the tri-state area. Thank you for being here with us today, Erin, and I'll hand it over to you.
Right, thank you very much, Maggie. So what I'm going to go over today are the parts of Medicare. There are actually 4 parts, and delve deeper into them, as well as answer any of your questions at the end. So as you can see on the first page, Medicare actually has 4 parts to it. Part A and B, which are above the dotted line, you get through the federal government, and Part C and D, you get through private concerns. So when a person enrolls in Medicare, there are a lot of reasons for them not to, but we won't go into those. But when you are ready to enroll in Medicare, you actually want to enroll in Part A and B. And Part A covers a person's hospitalization mainly. The deductible is for their room and board. And the patient would pay 20% of all the medical bills. So there's a $1,216 deductible each time you go in, and you would pay 20% for any of the medical bills. Now, the deductible would not be charged again if a person went into the hospital for the same diagnosis within 60 days. But if it's a different one within 60 days, you pay the deductible again. The Part A also covers a person in skilled nursing facility, and it also has a home health care component. So when you have a skilled nursing situation, you also pay the deductible of $1,216. You pay 20% of all your medical bills. Your first 20 days, however, are covered. You just would pay the 20% of the medical bills. And after that, as you can see, you would have a per day charge. So it can be quite expensive to be in the hospital. Medicare doesn't have an unlimited hospital day situation. As you can see from the days, you have up to 90 days, you pay a certain per day fee. And then they have something called 60 reserve days. So if a person has just Medicare Part A and they go into the hospital and they're there for more than 60 days, they would have a per day charge up until the 90th day. If they happen to be in there longer, then they have what are called lifetime reserve days, and they would pay the copay for those days. Once the lifetime reserve days are used up, then they would not have them anymore. So even though we don't hear about people being in the hospital for 60 or 90 days or longer, it does happen to people, and we don't wish it on anyone, but it does happen. So these are some of the reasons people buy other insurance. Part B of Medicare is the medical part. This covers not only going to the doctor, it also covers outpatient surgery, any kind of testing that the doctor might send you for, physical therapy, the test. It also has some home health care, actually. The home health care is determined by the diagnosis, whether it's going to come under Part A or B. But still under Part B, even though the deductible is $147 annually, so it would just be one time, you still pay 20% of all the medical bills. So it can be also a hefty charge. Now, Part A does not have a premium because we've actually been paying for it in our paychecks our entire lives. But Part B, you do have to pay for, and you pay the federal government based on your adjusted gross income from the last filed tax return. So when you enroll in Medicare, you actually do it through the Social Security Department because they're the ones that have access to your IRS records. When a person calls 1-800-Medicare, they do not have access to that. They only tell you about the Medicare benefits. So the enrollment does start at the Social Security Department. The enrollment can be done online depending upon the timing of when a person needs to be on Medicare. Generally, 3 months before you know you're going to go on Medicare, you can enroll online at medicare.gov, and there's a button on the first page that takes you to the Social Security website. It's just easier to go through the Medicare site to get to the enrollment process than to start off on the Social Security page, because you'd be hunting for forever in some cases looking for how to enroll in Medicare. So let's see, those are Parts A and Part B. And the other thing about the premium for Part B is that they tell you by letter within about 2 weeks' time what your Part B premium will be. The last page of my document here will also show you, based on this year's statistics, what your Part B premium would be. They do occasionally go up. Our understanding is that they will not be going up for next year, but anything could happen. And the announcement for if the Part B premiums go up would always be made in the end of October. And it's determined by Congress, actually. Now, the other parts of Medicare are C and D. Part C are called Medicare Advantage plans. These plans have been around for over 20 years, and they are through private plans such as United Healthcare, Aetna, WellPoint. In New York, we know them as Blue Cross and Blue Shield, Cigna, and many others. There are a lot of regional Medicare Advantage plans throughout the country. These plans are the reason a person might want these plans is because of their cost effectiveness. In many parts of the country, these plans are zero premium. And the reason for that is the government is actually paying all these big carriers to give a person Medicare benefits. In a way of saying it, they're outsourcing to these carriers to give a person Medicare benefits. So they're paying the bulk of the premium, and then the carrier processes all the claims. And this reduces the fraud in Medicare, which is the whole reason that these Medicare Advantage plans exist. So some of the Medicare Advantage plans give a person benefits beyond what Medicare does. It may or may not be a reason for a person to sign up on the plan, but they do give them benefits above Medicare, which we'll get into in a second. And if you have a Medicare Advantage plan, all the benefits, again, are federal law, so they're the same benefits as in Part A and B of Medicare. Part D is the prescription coverage. That came in existence, well, maybe 50 years, 40 years after Medicare did. So in 2006, the prescription plan was added to Medicare. And again, you get these through either agents or carriers. And there are over 600 prescription plans in the country. Not every drug is on every plan. So there's a way to search all the plans to see which one would be the best for a person. And it would be based on the prescriptions that a person takes being on that plan and the premium. And there is a way to do that on the Medicare.gov website. And there are other ways to do it too, but it's very important because some people just sign up on a prescription plan because it's with Aetna or some well-known name, and that does not mean that their prescriptions will be on that plan. All the prescription plans also have mail order, or you can go to a pharmacy. It's not mandatory to do one or the other. So let's go to the next page, and then we can look more at the options a person has when they go on Part A and B of Medicare. So there are actually two options, and within each option there are a lot of choices, which is where a lot of the confusion is. So the first option would be a person could take a supplement or Medigap plan. These terms mean exactly the same thing. Medicare and You, which is the national handbook that Medicare sends out, uses these terms interchangeably, which causes confusion when you're reading about the options. But supplement and Medigap mean exactly the same thing. So what do they actually do? Well, when you have a supplement plan, and there are 12 different supplement plans, and in any given state, there could be 20 or 30 different carriers that offer the supplement plans. So all supplement carriers do not have to offer every one of the 12 plans. Some states, it's mandatory to offer some, but all of them don't have to be offered. So the way they actually work is that the provider sends the claim to the federal government, to Medicare, and Medicare pays 80% of the bill based on Medicare's schedule. And then Medicare automatically sends it to whomever the supplement carrier is. And they'll know that because the doctor has forwarded them that information. So the supplement plan would pay according to whatever plan a person bought. As I said, there are 12 of them. So some plans will pay the 20%, which would be the balance, and all the deductibles. Some plans would pay half of that. Some might pay 75%. Some might pay just, maybe have a small deductible for the plan and you pay a copay. There's a high deductible supplement plan. So there's a variety of plans to meet a person's financial needs, actually, and based on the doctors that they go to. In New York, we have a lot of doctors that don't take health plans or Medicare, or they might just take health plans. So in a situation I had recently, none of the person's 5 doctors took Medicare. So he opted to take a high deductible plan because he knew he couldn't submit any of his claims to Medicare to get reimbursed. So he was actually using his high deductible plan to pay for any hospital costs that he might have, or home health care and testing and other things if those were Medicare providers. So that there's a lot that goes into choosing which one of these plans would meet a person's needs. So those with a supplement plan, you also can go to any doctor that accepts Medicare in the country. They do have a overseas benefit. They give you $50,000 worth of coverage overseas. It has a small deductible, but it may or may not be enough depending upon what would happen to a person. So it's always wise to get travel insurance when you're on Medicare. Now, the second option a person could have if they're on Part A and B of Medicare would be a Medicare Advantage plan. So instead of having the supplement plan where you may be paying a hefty premium, in New York it could be up to $300 a month, You could have a Medicare Advantage plan. It may cost you zero. All for the most part, the premiums are all under $100 for all the carriers in New York. And you would pay a copay whenever you saw a doctor, had a test, had home health care, maybe had outpatient surgery. If you're an inpatient in the hospital, there are copays for everything in exchange for the fact that you either have no premium or you have a very low premium. And the name Advantage does mean something. As I mentioned previously, they do have some benefits that Medicare may not cover. So, for instance, some plans pay for an annual gym membership. They'll have vision and eyeglass reimbursements. They could have some dental with their plans. And Medicare itself does not cover dental gyms, no. And they also Medicare does not cover having your eyes examined for distance and reading glasses. Any medical conditions covered, but I guess they just don't want us to see what we're reading. But our glasses are not covered, nor to see if they need to be strengthened. So with the Medicare Advantage plans, there are a huge number of carriers across the country. And the plans are by county, not by state. So the supplement plans would be by state for the most part. There's some states where you have to go by zip code or county. But the Medicare Advantage plans are by county. So you may have a friend that has a Medicare Advantage plan with United Healthcare, and they live in one county in New York. And you'd say, geez, that plan's not offered where I live. And that definitely could happen. The way the government set up these plans is to pay them by a lot of statistics by county, and that's how the plans are given money. So indeed, in some parts of the country, the Medicare Advantage plans are not offered at all because the government cannot give the carriers enough money for the carrier to offer a plan and still have it be a reasonable premium and low copays. One of the other advantages of a Medicare Advantage plan is that it covers prescriptions. So you get all the parts of Medicare in Part C. So that's the hospital, the medical, and the prescription plan. All comes with one carrier. Some of these plans are HMOs. Some of them are PPOs, some are POS plans. So with a PPO, a preferred provider organization, you could go out of network. The doctor still has to take Medicare, but you could see him if he agrees to the payment, and that's arranged through the carrier and the doctor. You don't have to be involved in that. And the POS plan's the same thing. You can go to any doctor. Again, they have to accept Medicare, and you would pay a percent or a copay under either one of these scenarios. So there are people that take a Medicare Advantage plan. Most of their doctors are in the network, but they might have one or two doctors that they don't see very often that are out of the network. So based on the finances of how much everything costs, it could be more economical for them to be on a Medicare Advantage plan and maybe pay the doctor. Some of the plans you pay them a copay, some of them you might pay 30% of their bill or 40%, and that would be of Medicare's rate, not exactly what the doctor's charging you. So that could work out for people. The best thing is to have most of your doctors in a Medicare Advantage plan because that's where it's going to be cost effective for a person. And I think that's it for those two options. So we can go to the third page now and talk about the prescription plan that came into existence not too long ago, 2006. So there is a lot of confusion with the prescription plans because there are so many of them. And in today's world, the last 2 years, I'd say, because a lot of the pharmacies like CVS and others have their own Part D plan. If a person would go into, let's just use CVS, and I love CVS, I go there myself, but if you go into CVS, they may or may not tell you that another plan would be better because they have their own Part D plan. So again, it's good to find, either go to Medicare.gov and put in your own prescriptions yourself and see what plans come up, or have an agent or a broker do it for you so that you know you're going to get the best possible plan. Now, the Medicare prescription plan is actually in 3 stages, and that's the term the government uses. They don't use it all the time, but when explaining it, that's the way they want it explained. So even in the Medicare and You handbook, they use different terms, but this is basically how it works. Some plans have a deductible, so if the plan does, and that if you had a plan that had a deductible, you're either on no prescriptions or you're on a lot of prescriptions, and it turned out to be the best plan financially for the person. So just because it has a deductible, a person should not shy away from the plan because it could be better financially. The plans also have tiers. Some plans have more tiers than others. So you have to look at that, and you can find out what plan your prescription is on way before you enroll. So that's a good thing too. So after a person would pay a deductible, if they have one, then you're in stage one. So stage one is probably what you're used to now. You would pay your copay, whatever it is on your card, whatever the carrier says is your copay. The insurance carrier actually pays the balance of the price of the drug. When you and the insurance company together have spent $2,960, you're in the second stage. So in the first stage, a person may pay a couple $100 typically. The insurance carrier is paying a couple thousand. But when your copays and the balance of the price adds up to the $2,960, you're in the second stage. All the carriers do send people monthly notices on where they are in these stages. So you don't have to keep a record of it yourself, but you can if you want. Your drugstore would have it as well. But the carriers are sending people monthly by federal regulation where they are in the stages of the prescription drug plan. So getting back to stage two, if you are do get into stage two, it's called also the donut hole. A lot of people have heard that expression. You would pay out of your own pocket 45% for the brand name drugs and 65% for the generics. These are based on discounted rates depending upon the carrier that you have and the drugstore that you go to. So it gets a little confusing, but it's not too hard to figure out. And plus, some people just go to their normal drugstore if they're in the donut hole anyway. It really isn't worth it driving all over town figuring out how you're going to save $1, $10 maybe, but it's, again, if you had an agent, they could tell you how to do that. Or if you went on the Medicare.gov website, you could see what would be the best pharmacy to go to. So if a person is unlucky enough to get into the donut hole, then they have to spend approximately $2,000 out of their own pocket. And again, they get to it by paying 45% for the brand name drugs they may be on and 65% for the generics. So if they have spent this almost $2,000, they're in the third and final stage. And in that stage, a person would pay 5% or possibly less, but not more, for the cost of the drug. Now, the prescription plan is based on a calendar year, January to December. So if you sign up during the year, then it would be prorated. So you wouldn't get all of this if you signed up in June. You'd only get half. So the prescription plans also have mail order. Now, over the last 2 years, we've seen that the mail order is not saving people as much money as it used to. Some plans, it is still 2 co-payments for a 3-month supply. Other plans, it's not. You might get 2.5, or you might not get any break by using the mail order. So when signing up for a prescription plan, it's important, if it is important to you, to know those things. You need to ask. The other thing about the prescription plans are, if a doctor orders a drug for you and it's not on the formulary of the plan they happen to be on, he can call there and ask for an exception so you can get the drug. A lot of doctors don't really want to do this because it takes time, but it's part of the Medicare drug plan that they have, that they can call up for you. They have to call because they need to state the medical reason why you need the drug, as opposed to a drug that's on the formulary that would be just like it. There are over 20 classifications of drugs, and Medicare regulations are that at least 2 drugs in every classification need to be on a formulary. So you can see that there's a possibility a drug might not be on it. Most of the carriers have more than 2 in each classification, many more than 2 actually, but there is a possibility that your drug won't be on a formulary. So the doctor can call up and get an exception. Now, most of the time, when a drug's not on the formulary, it's a brand name drug, and your co-payment would be determined by the carrier. It's usually the highest co-pay that they have for the prescription drug. So some drugs and their high co-pays are $95 a month. There aren't too many that are higher than that. So I suggest to people, and you can do this with your own plan now, is to get a copy of your formulary and either take it with you when you go to the doctor, or just keep it in the folder in your doctor's office in your folder, so that if you need a prescription, he can make sure that it's on your formulary before you even get to the drugstore. And that would save a person a lot of heartache, actually. So what some of the reasons that a drug might be an exception would be, you might be allergic to it. So I can't take the drug that's on the formulary. I just, it disagrees with me. I break out in hives. I'm awake all night because some dyes do strange things to people. So these are certainly medical reasons that the doctor could call in and get you the prescription that's right for you. Also on the prescription plan are injectable drugs. Now, these would be drugs that you would get from a specialty pharmacy, not necessarily from CVS, but you could. And those are usually very expensive. You would be paying, for the most part, 50% for an injectable drug. And it's because they are very expensive. And again, that does go through all these stages as well. So some people need to get through the stages as fast as possible so that they're only going to pay 5% for their drugs for the rest of the year. And some people, you want to delay it. So there are ways to do it, actually. And some of the ways you may know of already, that the places such as Target, Walmart, Stop and Shops, Costco, and other places have on their websites a list of generic drugs, only generics, that only cost $4. And you don't need a health plan to get the prescription filled. You can just go in, here's a prescription, and it costs you $4. So these are some strategies to use for people to prevent them from getting into the donut hole. Even if it prevents a person for a month, it could save them a couple $100. So when we do the drugs for people, we do analyze that, and any good person would do that for you if you're going through an agent. So I think that's it with the prescription plan. Let's just look at the last page now. These are the Part B premiums by income. So let me just get to that. Here we go. So as I said, these have not changed in about 4 years. And from what we understand, they're not going to change next year, but the year after they probably will. So if a person makes 85,000 or under, they would pay the federal government $104.90 a month. And if you're getting Social Security when you sign up for Medicare Part B, then it's deducted from your Social Security check monthly. If a person is not getting Social Security, the government will bill the person quarterly, and you just send them a check. So you can go on down the line here, and the last amount is, and you don't get any break if you're filing jointly. It's just double. And if you're filing jointly and one person is under 65, then Social Security, of course, takes that into account, and they would do it according to the individual schedule. So when a person is signing up for Medicare and a plan, this is one of the figures that also enters into the equation of how much you're going to be paying for your health plan. And many people don't take that into account because they don't know that they have to pay the federal government to be on Part B of Medicare. Again, Part A is more or less, in quotes, free because we've been paying for it in our paychecks all our lives. So we can look forward to the bottom two tiers. Those are the ones that they're talking about being raised, not next year, but the year after. So we'll see what they do to the other ones. But again, it's usually announced all over the news towards the end of October every year. So with that, I would love to have some questions from the audience.
Thank you, Erin. This is Lisa Ernst, and Maggie and I have switched places.
All right.
But so I want to ask you about this particular slide, and then I have a couple questions that came in over the chat. So in the beginning of the presentation, when you had the slide up for Medical Part B, and it was based on adjusted gross income, this is the chart that you would then look at to figure out if you were going to, and that would come out of your Social Security, the 104.90?
Yes.
Okay, I understand that. Okay, so let me just go to a question that came in. If you have health care coverage through your employer, can I still apply for Medicare?
A person may or may not want to apply for Medicare if they have group coverage. So if you have under 20 employees, you need to go on Part B of Medicare because it's a federal regulation that Medicare is going to pay your bills first. And if you're not on Part B, then you'll be paying that amount. If it's over 20 employees, then you do not need to go on Part B of Medicare. Part A is free. It's worth it for everybody to go on Part A and get their card because no matter what their health plan is, it'll help pay the cost either behind the scenes or it could pay some of your deductible. But from what I've seen, it's a very small part, but at least it's some of it. Another reason a person that's working may want to go on Medicare, even if it's over 20 employees, is because Medicare will be less expensive for them. There'll be a larger network of doctors and they'll have more benefits. Generally, they have more benefits. None that we really want because they all have to do with being ill, but they do have more benefits than a group plan.
Okay, great. The next question is, I did not hear you mention hearing aids. Are hearing aids covered by any of the plans?
Some of the Medicare Advantage plans have allowances towards hearing aids. The federal government's Medicare plan does not cover hearing aids, and they do not cover a hearing test. Just like the vision benefit, they don't want us to see, and they don't cover glasses. So same thing. And I don't think those will ever be Medicare benefits.
Okay. And another question is, when do I start planning for my Medicare coverage?
So generally speaking, because you can sign up 3 months before you know that you're going to go on Medicare, that would be the time to start looking at the plans and to sign up. You can certainly do some research or talk to somebody. I wouldn't do it more than a year, maybe 9 to 6 months, because the plans and the premiums change. The Medicare Advantage plans change every January, and the prescription plans as well. And the supplement plans raise their premiums not every January. Some of them do it in the spring, just depends upon the carrier. So, but generally 3 months before is plenty of time to get all the information that you would need to make the right choice.
Right. Now, I don't mind sharing with the audience that I've had my own personal experience with two aging parents when it came to their medical care. But so I have a question. I had to bring in a home health care person for both my parents, and they were not living under the same roof. So, but I actually don't have any recollection of being able to charge that to their health care plans. So, so is there a criteria for how you can get that reimbursed?
The home health care benefit has to be ordered by a doctor, and a registered nurse has to be overseeing the process, even if there's an aide there. So it's based on medical necessity. So Medicare does have a lot of guidelines around that, but it's really through your doctor that orders it and can get it for you.
Oh, I see. Okay. And then, Erin, I would love for you to talk a little bit about your practice, because I can just talk from my own experience. When you're working full time and you're managing your own life, and then next thing you know, you're managing the health care of your parents, it's pretty hard to keep on top of all of this. And I honestly didn't know there was a place I could go to get some support and help to sort of, manage through what I think is you have to have a PhD in understanding healthcare costs today. So could you just talk a little bit about what you do and how people can take advantage if they need the support of an expert in this field?
Sure. So what we do is we help people get on Medicare, number one, because a lot of people don't know how to do it or when to do it. And there are a lot of regulations around it, especially for persons over 65 and going on Medicare. It can be very complicated. So we help them with that aspect of it. Some of us have even gone to the Social Security office with people because they're just scared to death to go. They think of it as the IRS, but we've done that. And then we help them find the plan, because there are a lot of them out there that they want. We don't charge a fee because we're not able to. That's the way I set up the business. I didn't set it up as being a consultant where I could charge a fee. I set it up so I could represent as many carriers as we can handle and as many states that we're in. And if a person enrolls through us, the carrier pays us. All the carriers basically pay the same. So there's no horse in the game here that's in the race. It's just regulated by the government. Yes, some pay more than others, but we're doing it so that the person gets the plan that they need, both financially and health-wise.
So I wouldn't pay you necessarily, the carriers pay you to manage this interface.
Exactly. I cannot accept money.
Oh, wow.
Yeah.
Now, is a practice like yours routine throughout the country?
No, it's very unusual.
Okay.
I don't sell anything else. I don't want to sell anything else. I encourage people to get long-term care because when I'm going over everything with them, I show them where the shortfalls are for that because certainly, people do need it. 1 in 3 of us are going to need it. And anyway, the people are welcome to call me to get the information. And a lot of times I visit them if I don't talk to them on the phone. It just depends upon what they want, what state they're in, although I'd love to go to Arizona any day of the week.
Yes.
Especially last winter. And it's most people are just selling Medicare supplements so they can sell you life insurance or long-term care. So they'll come in the door with that, or they'll come in the door with a dental plan for seniors, and then they want to sell you everything else. So we don't do that, and I think that's makes us very unusual.
No, absolutely. So when they talk about in retirement that you would need the average of $250,000 for healthcare costs, because that's generally the number I hear, they're talking about just long-term care and facilities, or they're talking about sort of the Medigap and sort of the premiums you pay each month and the deductible costs adding up over, I don't know, 25, 30 years of retirement. Is that what, where does that
I think, yes, that's what they're doing. And as you can see on the last slide, the Part B premium, I mean, some people are going to pay $400 a month, and that's just for Medicare. They could be paying another $400 a month for a supplement plan, depending upon what state they live in.
Yeah.
And then the prescription plan and the co-pays, and if they go into the donut hole, the $2,000. So, yeah, it can be very costly.
And you do encourage everyone to get long-term care insurance.
Yes, I do.
Yeah, I think it's very important. Well,
Yeah.
Thank you very much, Erin. This has really been great. Thanks for an excellent presentation. And I want to thank everyone who joined us today. We hope that you'll join us again for future webinars on SavvyLadies.org. Thank you.
Thank you, Lisa, very much.
Bye.
Good day.